Subscribe to our YouTube channel and press the bell icon to get the latest updates.
Hi, welcome to ILANOMICS. The global economy is facing a new shock, and it's called the coronavirus or COVID-19. It's been disrupting services and manufacturing around the world. There are shutdowns, travel bans, and India has also joined this by sort of quarantining itself from the rest of the world, so to speak. What is the impact of this kind of a shutdown, and what will it do to the economy, which has already been facing a huge slowdown? Professor Ila Patnaik will talk to us about it. Hi Ila. This move by the Indian government to ban a huge number of visas, stop people from traveling to India, will lead to a lot of disruptions, and an economy already facing serious slowdown issues will take a further hit. I mean, this could not have happened at a worse time.
I agree, but I think that it's the right thing to do, because look at what Italy tried to do. Italy tried to say that we are quarantining off the northern regions where the virus has spread, and it's safe to go to Rome and to other parts of Italy. And then every day, before we knew it, it was too late. Every day cases were doubling, and the capacity of the health system is very low. What were they trying? They were trying, like we could have been making the mistake of trying, to protect the incomes of those who are dependent on travel, hotels, travel agencies, tourism, places to visit, museums. I mean, they were trying to protect their incomes. But the net result has been that instead of just foreigners not coming, today the whole country is in a lockdown, and business is going to suffer far more than it perhaps would have suffered if you had managed to control it in the beginning. And I think what India is trying to do is it's very clear we don't have state capacity. Neither do we have the kind of state capacity that China has, the policing, the monitoring, the virus police that Italy now has, where every person who steps out of the house in northern Italy gets asked why he's going, where he's going. We don't have those kind of capacities. So we're trying to limit the number of people who are spreading the infection. The virus is already in. So it's not as if there is no infection here. It is already in. It can spread. But I think our best bet is to just try social isolation, limit the number of people who fall ill, because we just don't have the capacity to, let's say, have 5% people of the country hospitalized. We just don't have the beds. We don't have the healthcare facilities. The medical staff is just not there. It's barely there to cope with what we normally have. And now think about an epidemic like this. So we're trying to protect, take charge of the facilities that are there, as well as quarantine.
That is as far as the virus and the outbreak is concerned, but also what we wanted to talk about was the impact on the economy. We were already feeling some of that once the outbreak happened in China. The supply lines got choked, the supplies slowed down, and you've written that it was a supply shock, and the supply shock is still continuing. Now, what happens with this new decision to block people from coming to India? It leads to another kind of economic impact.
It leads to a demand shock, a huge demand shock. So initially we thought that it would be a supply shock. It would be people who are dependent on, say, if the screen is coming from China, then the mobile phone can't be made. If a part in car production is coming from China, then even with one screw missing, you can't really make the car unless you develop capabilities of producing it here. So the discussion initially, let's say 3 weeks, up to 3 weeks ago, 2 weeks ago, was that, look, these are the supplies that will get disrupted, medicines, antibiotics, because they wouldn't come from China, inventories are finishing, port facilities are limited, trade will get disrupted. So disruption of trade was a supply shock, and that was the shock that we were talking about. Now, as we try to prevent the spread of the disease, there is a huge demand shock. Now think of the people who are not traveling. In addition to the foreigners, even domestically, a lot of businesses are saying stay at home. We'll try to do essential travel and not do other travel. Yeah. This is absolutely essential for controlling the disease. But in terms of people spending, if I don't travel, I don't spend, I don't go to the restaurants, I don't
take a taxi, you don't eat out, you don't go to a coffee shop.
Exactly. And all those people are going to see a reduction in their income, which means they will spend less. In addition to spending less due to the restrictions on movement, they'll also spend less because incomes will fall, which has a multiplier effect. Now, one can only hope and pray that this is not going to last for a long time, that, whatever, we manage to control it, whether it's summer, whether it's just isolation and our focus on washing hands. So, otherwise, globally, this is a demand shock. And in contrast to the supply shock, which might have been limited, it's a demand shock that is going to be widespread across Europe, America, Asia, all over the world.
From your experience and from what you've read, has there been a precedent where India or any major part of the world has seen both a supply shock and a demand shock at the same time?
Nothing like this. It's all concentrated in a few weeks. So usually what happens is that you have a supply, let's say you have a supply shock, and some companies which were producing the goods that they were initially producing, companies, individuals, small firms, big businesses, can't produce those. Now they were leveraged. They find it difficult to pay back their loans. And then you pump in some liquidity. So the US cut rates. Yeah. And that was the logic of that this is a supply shock. Some companies are leveraged. Now if we cut rates, then they'll find it easier to survive. Otherwise they may go bankrupt. But at the same time, you've not had such a big shock where you find that people are restricted from spending. Doesn't matter if they have money. They can have as much money in their bank accounts as they like, but if they can't go out, we haven't seen anything like this, at least in the recent past.
You refer to what the US has done in terms of trying to give a stimulus. President Trump has talked about giving a boost to the economy, which is taking a hit because of COVID. Britain and France are trying to emulate these steps. There has been talk, even Reserve Bank of India Governor Shaktikanta Das said if it comes to that, we will probably consider cutting rates. Do you think that is going to make a difference, Ila?
See, very little, because you think of the situation. If you give a rate cut today, yes, it will help some companies who are facing a supply shock. But are we today in a position where we'll go out and spend? Consumption spending is limited for other reasons, not because of this. Second, there is huge amount of uncertainty in the environment today, which has made stock markets very volatile, which has made investors very uncertain. Investors are not going to spend because of monetary stimulus at this time. So, they're right in the depth of it. Maybe a few weeks later, things look different. But if you ask me that will it make a difference today? Will a rate cut make a difference today? Not really. So that's as far as the monetary stimulus is concerned. On the fiscal stimulus, we have very little space already. We've been talking about how the budget, how the fiscal deficit is actually higher than, what we read in the headline numbers. In addition to that, if you have a demand shock, less incomes get generated, less people spend money, lower GST collections, lower income tax collections, excise on taxes on petroleum products, petrol, diesel, aviation fuel, all of them go down. So the deficit is likely to be bigger on its own, even without the government saying that I'm going to do a stimulus. So public debt is going to rise. If, this is not just a 1 week, 2 weeks phenomena, but if we see it over the full quarter, then we will see an impact on public finances. In addition to that are the costs of monitoring, healthcare, evacuation of Indians from abroad, quarantining, and so on.
And I mean, talking about the fiscal numbers, this is happening towards the fag end of the financial year, and we are, next month is the new financial year. Do you think that would force, the Indian government to rework its fiscal math for the next year, or do you think it's too early to go there?
I think it's too early to go there. I think at this time, we really don't know how long this is going to last. We don't know the impact on incomes. We don't know the impact on GDP. And nor do we understand fully what will happen if the virus really spreads in India. Today, we can count the number of patients, but tomorrow we could easily run out of testing kits. We won't even know how many people are ill, and in health statistics in India is normally very bad. And in a situation like this where testing capabilities are limited, where only a few labs have the ability to test, we don't know. So I'm just saying that before we can talk about the fiscal math, there are too many unknowns, too much uncertainty.
So you're saying right now social isolation is probably India's best bet?
That's India's best bet. I mean, one of course which they are doing is taking control over healthcare facilities, over testing, and a lot of testing, if it is done in private labs, then they need to. So they need to get control over the statistics, identify where the problem is, the location, how it is spreading, and social isolation, which will go on top of that information that they must gather. So that is our best bet, social isolation. But along with that, I would emphasize that you need to know where the disease is, so that you can then do social isolation. You can isolate the people who have had exposure, not just the people who are currently testing as having already contracted COVID-19.
I think the optimistic view is that, which people around the world have been writing, experts, is that we know this virus, we know how it behaves, and we know what it takes to deal with it. It's just a question of dealing with it. Hopefully that is something will come to India's help, because we have not been among the first to get it, but among the later ones to be infected by the outbreak.
We know very little about it, but still to the extent that we know.
Because other countries have had much wider outbreaks. And that should probably help India. Until then, social isolation is the best bet. Thanks for watching this episode of ILANOMICS. We'll be back with a new one next week. And until then, wash your hands, stay safe, and do subscribe to the YouTube channel of ThePrint.